Good evening. Myself, Dr. Suman Narayan Swami. I'm an associate professor from Samvad Institute of Speech Engineering, specifically trained and managing vertigo patients. So today I'm here to introduce what is vertigo and what technology we have for assessment, and then what are the treatment options for vertigo. Let me just share my slides. So basically, for achieving balance of the body, we need three systems. Okay, those three systems are important for achieving the balance. One is proprioception. Basically, that means your muscles, your bones, your joints, and everything. And then the vision. Vision is very, very important to know where you're standing, whether you're standing on a flat surface, on the edge, or on the hard surface, or on a smoother surface, all those things. But the unseen organ, or the less projected organ, is your inner ear. You can see the structure here. If I just magnify the structure, you can see here there are outer ear, middle ear, and the inner ear. Inner ear, there is like a snail-like structure here. If I can just magnify only the inner ear in the third picture, this part, the rotatory part, is mainly for hearing. And you can see some kind of rings here, and there is some nerve here. This part gives us the balance information to the brain. Mostly 80% of your body balance is actually done by this inner ear part. So if this inner ear goes with any kind of problem, say there are multiple problems which we will discuss in maybe 1 or 2 minutes. So what the patient faces is called vertigo. What is basically vertigo? When you are still, when you're not moving, when you are just sitting quiet, the entire room rotates around you. It's called spinning sensation. Even though when you are not moving, it just starts spinning. That is what I go. Why we should know about vertigo and what is so important about it is this: because it can take a patient for a task. It can mess the entire life. We have seen even the suicidal thoughts when the vertigo problems persist for a very long time, because it does just interrupts everything: walking, driving. You can't even get out from the bed, you can't stand from your chair. So it is very, very important to know what is vertigo. Once you know or understand the cause why you're experiencing vertigo, basically you will, when doctors can manage it very easily, and you will also stop panicking because you know this is a simple problem, not something life threatening. Who can get affected? Most of the people think the vertigo or giddiness or imbalance is only at the older age. Definitely not. It is a common symptom which even the child can get up to the older age. Mainly people with inner ear problems or people with migraine or stress, dehydration will feel more problematic with this vertigo. If I need to classify this vertigo into different disorders, these are few common disorders or common conditions where we can find. See, this is the inner ear which I was talking about. There are rings and there are small structures here. I will not go more into technical terms because it becomes a very, very technical thing. So I would try to explain you in a very basic manner. These rings are filled with fluid, and this particle, this round structures here, are having some kind of salt like crystals. This crystals and this fluid is actually telling the brain where you're standing, whether you're moving front, you're moving back, you're moving up, down, or you're tilting your head left, tilting your head right, back, down, wherever it is. Just imagine the small crystal particles. If it just enters this ring, the brain gets confused because there are two information which is going. Whenever you tilt your head, the fluid moves in one direction and the particles will move in the other direction because of the gravity. That's when your brain will get confused and the entire room starts rotating. It's a false information. That is called your benign paroxysmal positional vertigo. You would have seen this diagnosis most of the doctors writing, which is very, very common in vertigo, but easily treatable, which we don't even call it as disorder. It's just like a condition where some particles, it is supposed to be in one position, it goes to other position and creates a problem. It can be easily treatable, and it depends on which ring the particles are. Earlier we didn't have a technology to find out which part, I mean, the particles are in which canal. Your inner ear problems cannot be diagnosed with MRI or CT or blood test because structurally everything will be normal, but functionally it has a problem. So thanks to the technology, we have a lot of good assessment tools, which I'll be talking in a couple of minutes. This is one condition what I spoke about. Next is called Meniere's disease. Again, very, very commonly seen. Usually, I told there are fluid filled structures. This fluid should be always recycling. It has to go out and the new fluid should come. Sometimes this fluid cannot go out. Because of that, there is a fluid built up in your ear. Then you get your vertigo or chakkar or tale suttodu, whatever you call it as. Migraine, any kind of migraine in your younger age can trigger at the older age as your vertigo symptoms. Head injuries, it can damage the inner ear, or it can temporarily damage, or it can have a cut. Again, you will get vertigo. Certain medications can again become like a toxic for the inner ear and cause vertigo. Ear infections, and this central cause, I'm not touching this central cause. Central cause is something to do with your brain or the nervous system. That is all different topic. I'm only concentrating on the ear related vertigo issues today. What kind of symptoms when there is a ear infection or a inner ear gets vertigo problem? You may have spinning sensation, the entire room spins. You may have nausea or vomiting sensation, loss of balance. You will not be able to walk. You will be pulled towards one side, and then some unwanted ringing sound in your ears. You may sweat fully, and there is something called abnormal eye movement, which we call it as nystagmus. Sometimes patient caretaker will actually notice that and tell whenever he got vertigo, his eyes were moving up and down or rotatory. How do we diagnose this? Definitely medical history and physical examination helps us a lot, and hearing test to check whether the hearing is both same balanced in both left and right. Balance test, I told you, thanks to the technology, I will be discussing this in a while. Imaging, maybe MRI, CT if needed, if we think it is something to do with brain or nervous system. And maneuvers, BPPV, which the condition I told, the crystals moving. Traditionally, everyone follows one maneuver, which is not sufficient. We have, because I told you there are three rings in right ear, three rings in left ear. So you have six rings to be assessed. So one maneuver which universally everyone follows will not be able to tell you the correct diagnosis if the crystals are not in the targeted maneuver place. So this slides, I'm going to spend a couple of minutes because this is very, very important. Mainly, this is what we need to understand. I told you first, inner ear problem cannot be identified via blood test or CT or MRI images. Then how am I going to get the assessment, or how am I going to understand whether the problem is in inner ear? The list of tests which is being written here, say posturography, craniocorpography, head impulse test, functional head impulse test, BPPV maneuvers, and WEMP, VNG, all this test combinedly helps us to understand whether you have inner ear problem, or the problem is something to do with your brain, or the problem is something to do with your heart. All these things can be assessed by this. Simply, if I want to give few examples of how the problem will be and how I can assess. The patient comes with the complaint saying that whenever I turn my head towards one side, I feel dizzy. I'm not okay. So now, what is it telling me? Whenever the patient is turning to one side, his vision is not able to focus on a focused object which is supposed to be seeing at. That is what that is why he feels imbalance or the image getting shaky, right? So now in this condition, what we should do, basically we should start recording the eye movement in different head position, whether in the right, left, or shake the head, or take vertical movements. So you will get to know when the head is moving, what is happening to the eye. And again, thanks to the technology, now even zero point 0.5 degrees of eye movement can be captured. And if you can see here, say there is some red and blue marks, which is recording of the eye, which direction the eye is moving, whether up, down, right, left, all these things can be recorded. Analyzing this, we understand what is happening with your ears. First assessment tool called vi- video nystagmography. That means video nystagmus means the eye movement it is recording. The next thing, you can see there is a stable surface and the girl standing on it. Now I told you earlier, to achieve balance in a body, you need three systems. Basically, joint muscles, that is called proprioception, vision, and your inner ear. When I am standing on a stable surface like this, my proprioception is working, my vision is working, my vestibular system is working. Now, if I need to pinpointly assess only the vestibular system, what should I do? I should shut other two systems. Basically, closing eye will shut the vision system. Standing on a foam surface, unstable surface, will take out the proprioception information. Now what happens? Now our proprioception information is not there. Vision information is not there. If the patient has to achieve the balance, it is only because of my inner ear where he has to balance or she has to balance. By this, doing this test, we will understand whether vestibular system is good or not. There are few more tests. I will again not go into too much of technical things because that becomes too technical for understanding. But there are much more very sensitive test for understanding whether you have inner ear problem or brain problem or cardiac problem. What are the treatment options now? Okay, now we know we have vertigo, we have diagnosed the vertigo, we know there is an inner ear problem. Now what do we need to do? First thing is medications, vestibular suppressants or antihistamines to just stop the function or mellow down the function of your vestibular system when if it is hyperexcited in one side. Next thing and very important thing, or I stress again, very important thing is vestibular rehabilitation exercises. Once the vestibular system has lost its function, there are you can categorize the vestibular system or vestibular dysfunction into different types: temporary dysfunction, permanent dysfunction, or it's a mechanical. Each one, after diagnosing, we need to have rehabilitation. In conditions like neuritis, like there is some infection in the ear, and because of that he had vertigo. After that he has imbalance. Now while walking, he pulls towards one side, right, left, whatever it is. So if you just give medications and tell the vestibular system you don't function properly, you mellow down. It does not serve the purpose. So you will have to rehabilitate, which we have a tailor-made specific rehab sessions for each patients where the patients will be rehabilitated. Now I call this as one more rehab or treatment option is canal repositioning maneuvers. I told you BPPV, the crystals attaching into uh, different semicircular canals. There are three semicircular canals in right, there are three semicircular canals in left. So crystals can be in any of the canals. If we identify which canal the particles are, only then we will be successful in treating this patient with repositioning maneuver, because each canal has different exercises to get the particles out from there. For that, we need good assessment. Eye movement has to be recorded in different head position to identify the particles are in which canal. The next thing is lifestyle changes, like conditions like Meniere's disease or migraines. Not much of rehab or medications can help. Hydration, avoiding what triggers their vertigo, avoiding coffee, dark chocolates, excessive of salt can actually reduce the symptoms. Next is your surgical treatment. In very, very less cases, like there is any tumor kind of thing in your inner ear nerve, or there is a bone erosion, those kind of cases, definitely you can do a surgery and correct it. What patient has to do, all these things, the other things what I told, treatment options, what we are going to help you with. But what, as a patient, what you need to do when you get this vertigo? First, avoid sudden head movements, stay hydrated, manage stress, sleep comfortably, 6 hours, 8 hours, good sleep, limit caffeine and alcohol, sleep well, and follow prescribed exercises which they've been given by your vestibular specialist or vertigo specialist. There are, this is a very important slide which I just wanted to share with you all. There are few myths. Vertigo is just a dizziness. No, it is. It's specific spinning sensation. If it is inner ear problem, it will always be rotatory. The entire room rotates around you. If it is imbalance and all those things, it may not be even ear related issue. That we'll have to uh, do a detailed evaluation. Only older adults get vertigo. Definitely not. Anyone of any age, even 3-year-old child can get vertigo. It is not specifically to older adults. Vertigo is always serious. No, many cases are treatable and very, very benign. Benign means it's not life-threatening conditions. When to seek help? As soon as you get dizziness or imbalance in vertigo, if you have falls, if you have sudden hearing loss in the right or left, or vision blurriness, you will have to visit us. Ear blocking sensation, you have a ringing sound in your ear, or persisting vomiting again and again, definitely you will have to visit us for evaluation. If you have quick, I think I'm well on time. I'll just take 2 minutes of yours to explain why assessment is very, very important. Just see in the first video on top, I'm recording the eye movement. Eye is not moving at all. That means it is normal. Eye does not move. It means it is normal. When I'm moving my, he's not moving his head. He's still, the eyes are not moving at all. Now you just see here, head is still, but you just keep looking at the eye. Eye is slowly going towards this side and drifting this side. And it is very, very small drifts, what you can see. This drifts, if I evaluate without any kind of recordings or instrument, I would be missing this. And it is a case of ear nerve infection, which I just wanted to share with you, how technology helps us in diagnosing vertigo patients. One more, two more slides I have, where I just want to share. This is pre-rehab of the same patient, where one side the scores, you just don't go into too much of technicals. I just want you to understand how patients get information about whether they're improving or not. If you see pre-rehab, once I identified this person has a dysfunction, just see the score. It is 3 here, 2 here, 7 here. This is pre. After 10 to 15 days of therapy, that rehab, what I was talking about, post rehab, look at the score: 9, 9, 9. 10 being very normal, the scores have improved. If I show you one more slide, this is a very good. I told you that stable surface, the patient was standing on the stable surface. First day when I did, his scores were 46. That means very, very poor. This dark red, or you can call it as maroon, it is 46. If you can see here also 6.93. That is cushion surface. When I made him stand on the cushion surface with eyes closed, his scores are very, very bad. Post rehab, if you can see the right side, cushion surfaced, eyes closed, it has come into the normal range to the green. And if you can see the vestibular scores being 100%, that means rehab definitely helps. This is the technology, or this is the proof how the patient is getting improved with vertigo or rehabilitation. I'm done with my slides. If you have any kind of questions, I'm ready to take. We can just go with discussions. I will stop sharing my screen. Okay, there are few questions in the chat box. Uh, how can I prevent my vertigo impacting my daily life activity? Are there any specific exercises that can reduce my episodes? Okay, how can I prevent my vertigo impacting my daily living activities is the question which is being raised. Uh, to answer that questions, I would first want to understand why you are getting vertigo. First thing, a complete thorough assessment, because if it is an inner ear problem or if it is a brain related problem or anything else, I need to understand that to tell you how to prevent these vertigo episodes. Are there any specific exercises that can reduce my episodes? Again, the answer remains same. Yes, there are exercises to prevent your vertigo, but we need to first assess what is the problem. Based on that, we can suggest you exercises. There is no regular exercises for all the vertigo related problems, because I was telling the crystal related problem, we need to do a repositioning maneuver. For infection related problem, based on the dysfunction, I need to specifically tailor make the rehab sessions for the patients. Are there any surgical options for treating vertigo? Again, very yes. For few conditions of vertigo, there are surgical procedures. Like I told you, if there is any tumor on the hearing nerve, or there is a bone erosion, or if at all, if the Meniere's disease, the infection is not getting cured, or if it is happening, if it is becoming severe with medications, if he is not able to tolerate, there are surgical options called labyrinthectomy and neurectomy and all those things. That yes, there are options, but again, it is related to specific patients and specific conditions. Are there any alternative therapies such as acupuncture and chiropractic care that can reduce vertigo symptoms? Uh, People do claim, but I don't recommend it, because these vertigo problems are not being cured with those kind of treatments. Uh, but people do tell, but I would definitely not recommend that, because until unless you evaluate, because that's what I told. This vertigo evaluation itself is a very big challenge, because MRI, CTs can't pick those things. We need to have a specific evaluations for this. So I would not recommend that. How can I prevent my vertigo impacting my daily life? Okay, this I answered. If there are any more questions, I would be happy to answer. Okay. So Optima Super Specialty Hospitals, we are starting the vertigo assessment lab very soon. So patients can reach out to us for any kind of help who are facing vertigo for a very long time or a new symptoms. Uh, I would uh, I would again go back to a few information about why vertigo, how balance of the body is being maintained. If I need to stand on a stable surface, okay, or on a flat surface or a rounded surface, I need to see wall, how much distance the wall is placed. First thing, whether the surface is smooth or rough. Okay, should I stretch my hand like left and right, where they balance on the rope or something to weigh my body weight equally on the right and left? All this information is integrated at a brain level, and then your body balance is achieved. Out of that, 60 to 80% of the information is given through your inner ear. That's why inner ear is very, very important. We all knew from so many days that inner ear was only for hearing. No, most important function of the inner ear is body balance. If small changes to the inner ear or balance system in your ear can take your vertigo for, I mean, can you really take you for a ride with uh, uh, vertigo. One more thing I want to highlight is your balance system. The what I was talking about inner ear is not only involved with your balance. It is like your internal GPS, how your mobile phone has a GPS. If I need to go from here to Jainagar, how the way is navigated, your inner ear also helps in that, because there are specialized cells in your brain where they seek information from the inner ear, whether the person is walking straight or taking right or taking left, which place they will see the images of the road. It will keep mapping. All this information to the brain is given from your inner ear. That's why we call it as internal GPS of a human being, because it definitely helps you in lot of navigations also. Are there any more questions so that I can take? I think there are no more questions. Yeah, thank you so much for this opportunity. Thank you, Optima Super Specialty Hospital, for giving this opportunity. Hope everyone enjoyed the talk and got information on what I go. Thank you so much.